one of the just easiest signs or symptoms that come up with kid scoliosis is asymmetry in the shoulders. We see a lot during the summer. Kids are wearing bathing suits around their parents. They might, bend over the pool and they see a difference in the rotation or their shoulder blades. I'd say those are probably two common signs that are seen. Most of the kids are picked up via screening. Most of the screening responsibility has fallen on the pediatricians, as we don't screen in schools in Oklahoma anymore. And so a lot of the pediatricians are the ones that are doing scoliosis screening. And I would say that's probably where we get majority of our referrals is from pediatricians that have picked it up on their general well-child visits, and they're looking for shoulder symmetry when they bend forward, the change in the rotation of their spine.
Well, globally, females are probably the highest incidence of having scoliosis. It would be atypical for males to have scoliosis. So whenever males have scoliosis, it's a little bit different. We kind of take that a little bit differently in the way that we look and evaluate males.
Yeah, it's about 20-1, females to males.
Well, we have a variety of different ways that we treat kids with scoliosis, some of which is just observation, some of which we do bracing, and some of which we get further studies. And typically scoliosis is a non-painful condition, and so whenever it does hurt, we maybe look outside the box in terms of some further imaging, maybe being MRIs, but I think there's different avenues that you can go down to be able to screen for scoliosis, but also evaluate a little bit further. So every kid is a little bit different in the way that we treat them, and so might warrant some further testing, but also we have different avenues in which that we treat scoliosis.
On occasion, we might send somebody to physical therapy, but I think the take home is that surgery is pretty rare. Surgery is reserved for curves that are over 50 degrees, and most curves that present to us are much less than that, and I would say the lion's share of them are just treated with simple observation reassurance, and it's even pretty rare to have kids that warrant bracing, and even rarer to have a kid that warrants surgery. Yeah, it's pretty simple. Most kids with scoliosis present and really the only treatment is observation. We might just give a healthy dose of reassurance and maybe serial x-rays and follow a kid. Most curves don't progress to need any really invasive treatment. On rare occasion, you'll have a kid who curve is somewhere between 25 and 40 degrees that has a lot of skeletal immaturity, and they have a lot of growth remaining. And those are the small subset of kid that you would brace. And then curves that are beyond 50 degrees, those are the ones that warrant conversations regarding surgery. So really it's pretty simple. It kind of comes down to observe, brace, or surgery. Say on occasion, physical therapy is utilized along with those, but that would be pretty simply put, that would be it. I really think one of the big standouts in regards to our practice is this big multidisciplinary approach. The way that we look at a kid with scoliosis, we look at the whole kid. We look from head down. We look at their social situation, their family, their dynamics, their pain, their dysfunction, their x-ray, their MRI. We take everything into account and really generate a very specific and very detailed and a very unique, individualized treatment plan based on who they are. And I think we do it with compassion and passion. I think we're really devoted to the best treatment for kids with scoliosis.
And, through the complex spine pathway that we've developed over the 15 years that we've been doing it, we're able to really dot the I's and cross the T's, and Dr. Clark really does a good job of being able to formulate a good surgical plan, but then the execution of the plan is not just with him, it's not just with me, it's a team-based approach, in that we are able to take care of these patients afterwards, where we're able to really have a limited amount of time in the hospital, and we're able to have protocols in place, and that we have the nurses trained up well enough that they understand what our expectations are to be able to take care of these patients afterwards. So it is a team approach, and there's not just one specific thing that sets us apart. It seems to be the global overall team that takes care of these patients that really we're able to do a really excellent job of. We're really passionate about being able to take care of these patients, but also I think that we do a good job of educating the parents and setting expectations, and so that creates a good outcome of a good surgical plan.